show a bit in terms of some of our key metrics or indicators. Specifically, our daily case counts and our percent positivity are slowly starting to decline, which is a very good sign for us in terms of where we are with community transmission here. That being said, I think it's really important, and I must underscore that these numbers are still incredibly high. Our percent positivity is still above 30%. Our case counts are still well over several thousand a day. And so it's really important that we continue to implement, enforce, and manage those important mitigation things in all of our settings to reduce the risk of transmission of COVID here in Mecklenburg County. As has been throughout this entire pandemic, our hospitalizations and our deaths continue to lag. And so it really is creating significant strain for both of our healthcare systems. They will talk a little bit about the efforts that they're taking to be able to help manage through this surge right now, but it is certainly strained, and we are working very closely with them to make sure that they have all the supports that we can help provide as a department. I want to talk quickly about sequencing. I think as the last time we were together, I mentioned that the predominant strain in Mecklenburg was the Omicron variant. That still is true. We have not yet received our weekly surveillance report for this week, but we do expect that later today. We are able to identify the BA.2-like variation of the Omicron variant. We have seen that in our most recent report. And so we will continue to monitor that closely. I know there's a lot of chatter and discussion about that right now. And so we are, there's a lot to learn, I think. I know our partners at the CDC, state, and otherwise are monitoring that situation very closely. And we're watching what's happening in other countries. But I think it's clear at this time that there's no real indication that we should be concerned at this time. We'll keep monitoring and keep folks up to date as we learn more. Quickly to switch to talk about testing for a second. As you all know, we've worked to set up a number of testing sites in the community over the last couple of weeks. I want to say a huge shout out to our community testing partners who have been working very diligently to help get staff on board, to help secure space, supplies, and all the necessary tools to be able to operate testing sites. We are really encouraged to see those sites up and running and hope that it's helping folks in our community, but also taking some of the strain off of of the overall system. So I want to say thanks to our partners at StarMed and Mako Medical and other places who are helping us be able to make those testing sites available. We have noticed in the last 48 to 72 hours, we have seen a pretty significant drop in the demand for testing in Mecklenburg County. Many of our sites, if you go to them today, you can see you can probably get in and out in just about 10 or 15 minutes with little to no wait. So certainly that is good, but we want to continue to discourage people from using our emergency departments and the hospital resources for COVID testing. We do have plenty of space at sites across the county where people can get tested, and they should use those options and avoid the emergency department. As I already alluded to, our hospitals are under pretty significant strain right now. We are anticipating, we're expecting another shipment of rapid at-home tests on Monday. Unfortunately, we did get a shipping delay notification for those. We are expecting those to arrive before Friday. We heard from the vendor earlier today that they are en route somewhere between here and Connecticut. So we have went ahead and made plans to do another mass distribution this Saturday. We will be sending out a press release about that distribution later within the next 24 hours. To provide some details to the community about how they'll be able to access those tests. We are also going to distribute medical grade masks as similar to the last time as well. If you recall, last time we kind of went east and west of the county. We are going to go north and south this time. So we will have two sites set up on Saturday, starting at 10 o'clock in the morning. The first site will be at North Meck High School, which is at 11201 Old Statesville Road in Huntersville. And the second site will be at the Harper campus of CPCC at 315 West Hebron Street. Again, that's in Charlotte. So we will be starting that on Saturday morning at 10 o'clock, and we'll be going until 1 p.m. Again, we expect to have, again, ample supply of rapid test kits as well as masks, so there's no reason for people to arrive early. We really hope, again, we'll have a smooth process that folks can get in and out pretty quickly. And we will be using a similar approach that we did the last time in terms of 4 test kits per car, as well as a packet of masks for each household to take with them. At this time, I will come back at the end, but I'll turn it over to Dr. Fletcher to give an update from Novant, and then Dr. Hunter to give an update from Adrian.
Hey, good afternoon, everybody. This is Sid Fletcher with Novant Health. Thanks, Dr. Washington. I appreciate that. And I think a lot of the things that I'm going to say are really follow what Dr. Washington has said is going on for the county. So our hospitalizations, we think, peaked about 10 days or 12 days ago. So we've seen a very sort of slow drop over that period of time. And I think our models show that over the next 1 to 2 weeks, we expect a pretty precipitous decline, which is really, really great news. I would say that the testing demand has gone down quite a bit, just like Dr. Washington has mentioned. And we've seen our positivity rate right now of the people that we're testing is kind of mid-30s. So we're a long way away from that 5%. It has dropped some, but it's still higher than it's ever been at any point in the pandemic previous to this latest wave of Omicron. So I just tell you, there's a lot out there. We also noted that over 93% of the people that are hospitalized currently are either unvaccinated or undervaccinated. Just again, some of the repeat messaging that you've heard us say around that. In terms of variants, we mentioned BA2. Yeah, there's always going to be a new variant. One of the things that I think is important to reiterate is that we've seen that the vaccines are really great at what they do: prevention of hospitalization, prevention of death, with every variant that we've seen so far. But when you read it, you read out there, hey, there's a race because there's going to be a new variant. That's because we really want to reduce the number of hosts, those that are unvaccinated, that are in the communities, because that's what viruses do. They replicate, and when they replicate, they make mistakes, and that's the variants that you see. So know that there will be more variants. The more people that are vaccinated, the better we're going to do against this. Those are my main remarks, and I appreciate it. I'll turn it over to Dr. Hunter.
Great. Thank you very much, Dr. Washington. Thanks for having us here and the county for having this opportunity. And really, I'd also like to thank the media, because you're partnering with us to push out our important messages. Some of them may sound like a broken record, but it's the vaccinations. It's get your vaccinations, get your booster when eligible, and we need you to keep telling those stories. Well over 90% of our patients who are on life support are unvaccinated right now. So that's just another sign of how these federally approved, safe and effective vaccinations are doing what they're designed to do. So a little bit of hope that we're seeing these positive cases declining. The hospitalizations is always the last number to start going down. And although we've seen slowing of our case increases, we are not seeing any declines at this time. And so from the hospital's perspective, we are nowhere out of this pandemic. And I think as the community looks at those positive signs of decreasing cases, we need them to know that your healthcare workers are still in this battle knee deep, trying to get through. So we need you to keep doing the things that keep us all safe, that help us help you. And if you have a chance to see one of those healthcare workers, please show them some appreciation. Please thank them. We've all been at this a very long time. So that's where we would like the community's help with this. And lastly, of course, please get vaccinated. Please get boosted when eligible. This is our way out of the pandemic. So I'll stop there and turn it back to you, Dr. Washington.
Thank you guys so much. Two more quick comments before I open up the floor for questions. The first of those is I do want to just remark, I've got a couple of questions over the last week about case investigation and contact tracing. We have officially stopped our case investigation and contact tracing for the general public. That was following official guidance from the North Carolina State Department of Health and Human Services, where, again, as we're transitioning to really a new phase of surveillance for this pandemic. And so we will not be doing the general contact tracing and case investigation for the general public. We still will be doing contact tracing and case investigation, obviously,